Well, I had was started feeling a lot of pressure in the sinus area. I guess was the first thing I started noticing, and a little bit trouble just focusing quite a bit. And it was a little bit different than what I'd normally call a headache, and it was every day. Finally, I started going to went to a regular doctor and did a bunch of blood tests. It still continued after a while, and finally I just started hurting all over. I was felt like I'd been hit by a truck. So finally went to an endocrinologist, and she did an MRI, was one of the tests they did, and she called me back and said, "You have a large pituitary tumor." Said, "You need to get a good surgeon." She wrote down a name on a piece of paper and she said, "This is the best one."
So Mr. Duplantis had a tumor at the very base of his brain in the pituitary gland, an area that's very action-packed. The pituitary gland is the master gland of the body. It's a little P-shaped gland that sits at the base of the skull. Right above it are the optic nerves that control vision. Right to the side of it are the main arteries to the brain, the nerves that control eye movements, help you open and close your eyes. And unfortunately, Mr. Duplantis' tumor was squashing all those structures, causing him to lose function of his vision, causing him to lose function of his eyes. Left untreated, he would be blind and his eyes wouldn't even open.
Dr. Baskin walked in. It was almost like you just can feel his confidence. He was straightforward, very easy to understand. He showed all the different images and different angles of the tumor and described how he was going to do the surgery. The thought of going blind is pretty scary. You just, you kind of take your eyes for granted, and I just never thought that would be an issue. That was one of the scarier things about it, is possibly losing eyesight because of this tumor.
So it's a pretty scary thing and it's a concerning thing, but advances in technology have really revolutionized our ability to treat these tumors.
Said it was be a piece of cake. We'll get this out, you'll feel better in no time.
Previously, we had to actually open the skull, somehow lift the brain up to get to the base of the brain. Now, using an endoscope, which is a slender rod with a camera on the end of it, we can place this scope up one nostril, reach this area right here, remove the tumor without ever even making an incision, and actually, once we take the tumor out, we can rebuild the bone at the base of the skull so like it never happened. This is due to advances in technology. This endoscope is only 2.8 millimeters in diameter at the tip, about 1/10 of an inch. So it used to be if something was that small, you would have no resolution. But now advances in camera technology and CCD chip technology, we can have 1080p high-def TV Blu-ray resolution as we're operating at the base of the brain. So combining these advances in technology with knowledge of anatomy, we have a whole new ballgame for a patient like Mr. Duplantis.
Dr. Baskin said that I would feel like I have a severe sinus infection for a couple of weeks, and that's pretty much what it was like. I really felt good really quick. Within a couple of days after being home, I felt like I could do a lot more than they wanted me to do. But so I had to keep telling myself to, sit down, don't do anything. And my wife made sure of that. But I became a couch potato. Everyone in the hospital was, really great. I only spent one night in intensive care and one night in a regular room, and it was just too easy. I was real pleased with the work.